on the screen until the presentation is over. Am I audible? Am I clear to all? Yes, thank you. Okay, so the today's session that we are going to learn how to don the personal protective equipment, which is very essential while caring for a patient with COVID-19 positive patients. Okay, and this will be shown in the form of a video. And I request all of you to watch this video as I share my video. Okay.
As we are facing a great challenge of caring for a patient with COVID-19, we as healthcare professionals need to protect ourselves while taking care of a patient. In this video, we are going to demonstrate the use of personal protective equipment while caring for a patient with COVID-19. It's very essential that we protect ourselves and we use the PPE appropriately. At the same time, we need to use it very judiciously. Let's begin the video now.
We will start with donning of PPE.
Before moving into the session, the objective of this session is that at the end of the session, the participants will be able to demonstrate the procedure of donning PPE and also
It is not a sterile procedure. Donning is to be done in a designated donning area. Coming to the preparations for donning, ensure that you are hydrated and that you have had food. Use washroom if needed. Keep all articles needed nearby. You will require the PPE kit, the alcohol-based hand sanitizer, some extra tapes, surgical mask and gloves. Change into surgical scrubs. Use washable shoes if available. Tie up your hair. Take extra items off the pockets of your scrub. If you wear glasses, secure them properly. Ensure you are not wearing any jewelry. Perform hand hygiene. Wear the N95 mask. We are wearing the mask first here as we are near to the COVID unit and this would prevent or minimize the exposure of the air to the healthcare worker. For wearing, hold the N95 mask by placing the cup of the mask in one hand such that the strings fall downward. Place the cup of the mask on your face such that the nose and mouth is covered. Pull the lower tie upward over the head and take it till the nape of the neck. The upper tie goes to the top portion of the head. Fix the flexible band on the nose bridge. Now, fit test. Negative fit test can be done by taking multiple deep breaths. Look for dimpling of the mask. Positive test can be done by blowing air out while holding 2 fingers over the mask. Look for any significant air leak. Next is wearing the shoe cover. Sit comfortably on a chair. Take the leggings and wear them. The leggings should reach at least till mid-calf. Now perform hand hygiene and dry hands. Wear the first layer of gloves. The first layer of gloves should be snugly fitting. After wearing the gloves, inspect for any damages. Wear protective goggles. The buddy can inspect for proper fit of the goggles. If the person wears a specs, the goggles should completely cover the specs. Next, wear the gown or suit. Some PPE kits may be provided with a gown. The buddy helps to ensure that the gown or the suit is worn properly. The wristbands of the gown can be tied or taped to the first pair of gloves. Check for mobility. Wear the apron if it is provided in the set. The apron can be tied in the front for easily removing during doffing. Wear the second pair of gloves. The second pair of gloves is worn over the first pair. Ensure that the second gloves covers the wristband of the isolation gown. It is advised to have a different color gloves than the first pair. The body inspects the healthcare worker for any breach in PPE. The healthcare worker is now ready to enter the COVID area. There are some safe work practices to minimize our chances of contamination when we are working in a COVID designated area. We have to keep our hands away from our face. We should limit the surfaces touched. The more the surfaces that we touch, the greater will be our chance of taking in a contamination. If our gloves get visibly contaminated or torn, we have to change gloves immediately. Even though we are wearing PPE, we have to perform hand hygiene frequently.
Now we have completed the video of donning the personal protective equipment. I request you to kindly go through these statements and check them whether it is true or false.
Second.
Yeah. Now with this we have completed donning of PPE. Shall we move on to doffing PPE? Okay. Thank you.
Second.
As we are facing a great challenge of caring for a patient with COVID-19, we as healthcare professionals need to protect ourselves while taking care of a patient. In this video, we are going to demonstrate the use of personal protective equipment while caring for a patient with COVID-19. It's very essential that we protect ourselves and we use the PPE appropriately. At the same time, we need to use it very judiciously. Let's begin the video now.
Now we would see the doffing of PPE.
The objective of this session is that at the end of this session, you will be able to demonstrate the procedure of doffing of personal protective
Doffing
equipment.
is to be performed in a designated doffing area. The doffing area is considered to be a contaminated area. The front portion of the used gown, the apron, the outside of the gloves, outer surface of the face shields, front portion of the mask, these are considered to be contaminated surfaces. The articles needed for doffing. We would need a pair of clean gloves, alcohol-based hand sanitizer, a clean chair, closed container with disinfectant swabs, scissors, appropriate colored dustbin with cover. Coming to the preparation. Before leaving the patient room, inspect yourself for any visible contamination. If a visible contamination is present, it is wiped with a disinfectant. A trained observer should be available in the doffing area. The healthcare worker should enter the doffing area only when the trained observer indicates. First is the visual inspection by the trained observer. The observer looks for any contamination. If it is present, the contamination is to be disinfected by a disinfectant swab. Next is removal of the apron. The apron is removed by pulling it outward. It is to be rolled outward so that the inner non-contaminated surface is only exposed. Next is disinfection and removal of the outer gloves. The outer gloves is first disinfected. For removal, pull the gloves of one hand from outside and remove it carefully so that the inner gloves are not damaged. Once one hand glove is removed, roll and place in the second hand. Now remove the outer gloves from the second hand by inserting your finger in between the outer and inner gloves. Remove the glove such that this glove now covers the already removed glove. Discard. Disinfect the inner gloves. Next is removal of the gown or the suit. Unzip the suit and pull it away from your body. Be careful not to touch your inner scrubs. Roll the gown or the suit such that only the inner surface is exposed. Discard. Again, disinfect your hands. Next is removal of goggles. The goggles are removed by pulling it away from the face. Disinfect hands. Remove the shoe cover. Sit on the chair. Remove the shoe cover from one leg carefully so that you do not touch your scrubs or the other leg. Repeat with the other leg. After removal of the shoe cover, disinfect the shoes with swabs. Disinfect your hands. Next is removing the N95 mask. Remove the N95 by pulling out the lower strap over your head. Now pull the upper strap over the head and keep it taut so that it doesn't touch your scrubs. Disinfection of hands. Next is removing the inner gloves. After disinfection, follow the same procedure as for the removal of outer gloves. Disinfection of hands. If you are wearing any extra Next is visual inspection for any contamination. If the trained assistant is convinced, you are ready to exit the doffing area.
Now we have come to the end of this procedure. Kindly go through these statements and state whether it is true or false. Yeah, thank you.
बहुत सारे मैसेज
ये तो बोल सकती हूँ ना, वेबसाइट में है। Yeah, there's a question like, are we going to receive this presentation by email? I request you to log on to the website of AIIMS Bhubaneswar, and it is there.
You can type. You can type here.
Okay. .edu.in. Listen. Okay, you can log in. You can check in the website www.aimsbhubaneswar.edu edu.in, and you will see there is COVID information on right top of the website, and if you check that, you will find the videos in that. How available are these PPE in the market? Okay. Okay. This PPE. So there's a question, are these PPEs reusable or disposable? These PPEs are disposable. If there is no apron, what should we first do during doctoring? I think one or two have a written voice. Thank you. Any question and answer session? Any clarifications? We have still 3 minutes left. Site is not opening, they're saying. Eye shield. No, these are not reusable eyeglasses.
Asha, can I say something?
Yes, ma'am.
Yeah. What you gave was the email ID. Somebody wanted to know the website. Website is nic.in. So please give the correct website.
nic.in.
Yes.
Yeah. Okay. Yes, the assistant or the observer also has to be in full PPE during the doffing, because that is a very contaminated area. So the assistant has to be with a full PPE. The doffing area to be situated where before the exit area, and there should be access to washroom so that the person can have a wash or shower before changing into the other personal clothes. So again, I think they're saying cannot open the site. AIIMS open.
Two times to answer and Google it after.
If you open the website and Google, it will come. Is there any special precaution for the assistant? Yes, the assistant also has to take all the precautions, because the area where the assistant is observing the doffing or donning, that is a very contaminated area, and also the assistant should have a checklist to see that the person is following the proper procedure.
Hello, Mr. Niranjan ji.
I think the time is. Thank you. Are there any more questions or shall we wind up this session, the first section?
Introducing stuff. Introducing the events. Start Korea presentation. Start. What is on the query? Start. Stop sharing. Stop sharing. Start. Good afternoon. Welcome and greetings from All India Institute of Medical Sciences Bhubaneswar. Myself Prashant Mahapatra. I am a professor in pulmonary medicine and critical care and presenting you on COVID-19 clinical epidemiology and management of COVID patient, that's non-severe patients. So let's, as of today, we know that 80,000 cases If you look at the death rate, it's 3.7 more than 3.7 million deaths, and it's clearly showing which country has more cases and deaths. If you look at the daily cases, it's nearly 80,000 deaths. So it is huge number. I mean, the world has never seen it. And this is the website, I could get it. It's American data, not Indian data, I could not get. So this is showing that USA per day, it is almost, death is around 3,000 deaths per day. If you look at this predicted death, so by end of August, that has been, graph has gone. And by 4th of August, that has been predicted. So this is prediction. And this, coming to the topic, this case, a person with laboratory confirmation of COVID-19 infection, irrespective of clinical signs and symptoms, is called as a case. So what is the contagious period? That means patient infect from others. How long infected person transmit virus to others? That is very important because it is very contagious. So it's primarily this is, it depends on which fluid, where, how you get contact. It's high likely to be contact if there is a body fluid contact. Is less lysing is aerosol, and mean between droplet and fomites. So primarily, but it's primarily spread by respiratory droplet. That is common because body contact, body fluid may not be always. And one virus is a heavy virus. It travels even of cough. It's not more than 1 meter usually. So this is the mode of transmission. So primarily spread to droplet, which release between when patients coughs, talk, sneezes, sings, all this, and it travels a short distance and cannot travel long distance because physical and biological decay of the droplets. What's your risk? What is our risk? Risk is not only patient, we are also at risk. So this droplet aerosol is go to the, like dental doctor is practicing dental practice, and patient sits in dental chair that got infected, contaminated, and direct contact to the doctor's thereafter, and airborne it can be due to side by healthcare worker. This is not only applicable to doctor, it is also respiratory clinicians and all even ophthalmologist. This is for ENT surgeon. This is even if radiologist. All these were so, and not only that, this virus can stay for hours, maybe 4 hours, particularly in copper surface where you use the door bolt, or maybe plastic, it is 2 to 3 days. Maybe where you wash your hand, that also this basin, wash basin, this 2 to 3 days. And you know that cardboard, it stays 24 hours. The incident was happened in Delhi. So that pizza worker become a pizza delivery boy, got positive, COVID positive, and many family got quarantined. It's spreading disease at bus. Look at single person infected at this rate, that can, 30 minutes, it spreads to it's a bus, many people in bus, and particularly air-conditioned bus, it is where the turbulent airflow that infect many. Let's see, where have your hands been? We are see in party, every dance, the hands touch each other. Even if you go to hotel, pay our bill, even if credit card, that also touches their purse, and then no by counting notes, even in party. And look at the train where we're traveling. This is in the gym we are using elevator, and that petrol tank, lift, even if using somebody else's computer. In supermarket, you use that trolley. So all this can be contaminated from the patient. Just be aware of this is the way we can avoid contamination. And coming to the disease, its median incubation is 3 to 5 days, and range is 2 to 4 days. So that means most of the patients got developed disease 3 to 5 days after infection. It can be latest it is seen around 20 days, one in reported percent. Otherwise, the most important is basic reproduction number. That means how many people one person is likely to infect. That is, we say it is R naught. R naught is the average number of secondary cases attributable to infection by index case after that case is introduced to a susceptible population. And that range, initially we thought zero means patient doesn't infect others. R1 means person who infect only one person. R2 means disease spread is 2% in span of 4 to 5 days. 2% next 4 days it is 8%. So this is R naught. This is why I'm saying it. This is recently few days back it has come up. This is the this R naught is varies up to 6.5, and this is exponential. Even if forget R naught is 5 or 6, even if R naught is 2. In span of 16 days, it infects 16 people, and next 4 days it is 64. Next 4 days it 200. Something. It is next is around 1,000. So means it's up, and 20 days it's thousands persons become infected. Let us see how we can stop infection. Infected persons coughs and seizures. That means we should stop it by catch it, and that droplet infected to person hand. We should wash our hand, and infected hands touches the surface and clean it. Whenever the person touches, clean it. Again, droplet up to 2 meters, maximum 2 meters. Again, surface to be decontamination is required, and most important is keep distance, cleaning. Surface cleaning is most important. Touch contaminated surface, again clean, and don't touch face. Try to avoid touch, because if you are touching this like I'm touching table, and also you can touch in eyes, touch in mouth, nose. So finally it is got infected. Let's public health objectives, all stages, preparedness and response. That this is introduction of the virus. Then there's a localized transmission. Most of the places are localized except few. That if you take early detection and containment, that prevent outbreak, delay spread, slow and stop transmission, that provides optimal care for all patients, especially those are seriously ill. So let us discuss, compare with the phases. The phase 1 is a sporadic cases get imported from other countries. So that means that time is already gone. Good cleaning, the early detection, isolation, contact tracing is more important. Even if phase 2, early detection and contact tracing is important, what is going on in most of the places in India. And that means this is imported cases. The phase 3 means where the community transmission, that is the main way, widespread transmission in the society. And the next phase 4 is full epidemic. In particularly stage 3, the definition is where we cannot trace a person from where get infected. That means patient we cannot trace, contact cannot be traced. That means the infection is already in community. And next phase is full epidemic, and next phase is late epidemic. Most of the people get the immunity because of herd immunity. Then disease cannot spread. I'll show you later. And most of the practice are same: hand hygiene, cleaning, social distancing remain the most ideal method of prevention. Let us see what has happened. If you do not control the disease, see how many patients sick at a point of time. This is a cumulative patient. So suppose it is very fast going. This is in Europe and America. So that means even if they have tried to control, but still it's beyond control. So cases without protecting, do not have any protective measure. What is this is going to a number of sick patients. This is the hospital bed. Let us see, this is the level of hospital bed. This is the number of patients is so much. We do not have hospital bed to treat the patient. We cannot admit the patient. We are definitely patient is going to neglected. We do not have that much of manpower also. So that means we should not get the patient to be infected disease beyond the level of capacity. That is the reason the country is preparing with many COVID hospital, many COVID bed. So that means it's to tackle the problem. And if you flatten the curve by different strategy, by washing hands, not traveling, staying at home, and avoid hosting large gathering. So finally, number of sick people will slow down and spread. So that means we have flattened the curve. If in between you stop it, again it is going to come back. We do not know how it is going to come back. It is very costly, very, very costly. Let us see what are the other methods. Avoid contact, wash hand, and do not eat raw food, thorough cooked food. Meat and eggs can be taken. There's no contraindication. Avoid contact with animal product, and stay home, and cover the nose if you're coughing. And now this mask has been mandatory, even if you're fine, good health. Keep objects clean, and do not do handshake, and don't try to avoid contact, and wash shop. Let us know the disease is spread out, but how it is affecting us. Let us country, this is a place, this is India, or maybe your country. There is no, that means we do not have a vaccine now, and social distance is not done, initial phases. Before our preparation. Let us see, one person red is infected, the other person, that means there is box is social distancing, and dark blue is healthy. Rest are healthy, only 2% infected, and see infection freely among individuals. Finally, rest are all infection spread except few. And end outcome is this gray one is died, almost 50%, more than 50% died. Maybe some good number of person died. The rest of the people develop immunity by getting infection, and they got infection, but in their own body they protected from the getting diseased. let us come to second scenario, middle one. There's no immunization as of now, everybody know, but we are maintaining social distance. How we going to help it? The same 3%, let us see 3% infected, but only the 3% that infect only one neighbor, because infected person cannot infect another diseased person. So again, only few percent get infected, and rest are fine. What we are doing it, and end outcome is some definitely makes many people will be healthy, some people will get developed, and few people will die. Let us
Hello, PPT are visible? Hello, sir? Okay, fine. Thank you, sir.
sorry for interruption, and let us see what is our condition. There's no immunization started. Vaccine is, we got vaccine. That means, see, this person has got immunity to the light blue or green color is that got immunity. So that even if patient is infected, he is unable to transmit the disease. The disease, there cannot be just never cannot be disease, because he already got herd immunity or some vaccination is given. Protection cannot pass freely among the individuals. Then most of us get protected. This is called herd immunity we are getting. So what is herd immunity? It is the immunity of the community.
Stop sharing.
It is immunity of the community to stop COVID. So that means, let us see. There's a sustained transmission and susceptible. Everybody is getting disease. There is no herd immunity. If there is a herd immunity, then person is immune, that this cannot susceptible, cannot be disease cannot go to another susceptible person, because he cannot bypass it. And let us see, there is an incomplete herd immunity and complete herd immunity. If there is incomplete herd immunity, some person will be infected, will be diseased, and vaccinated will be escaped. If there is many people are getting herd immunity or vaccinated, the rest of the people are getting, surrounding people got herd immunity. So diseases remain protected in community. So let us come into the how we can control the infection. That has already discussed yesterday. But even if we get a suspected patient, it is our first responsibility to control the infection. And we give a patient to a triple layer surgical mask, not with that mask. That mask like this. This has a valve. Because why I'm showing it, this valve is one-way valve. If you give a patient, all expiration will go to hospital air or outside air. So this valve mask is only for the doctors, healthcare worker who is a healthy person. So to give a mask, surgical mask preferably, not means not to be too much means liberal to give some PPIV patient 3M mask or the valve mask. So please do not do that. So that is harming to hospital. So keep the patient isolated area and maintain at least 1 meter distance between the time. And adoption of COVID-19 trial strategy for a particularly important for low income setting is initially basis of this algorithm basis of fever and cough, and it has to be combined with epidemiological methods we discussed, and patient more isolated, and more infection control and prevention, and once you get a patient taking history, we should do chest imaging, maybe point of care testing, in addition to RT-PCR testing, and patient usually present with fever and cough, and also shortness where patient can have a diarrhea, vomiting, pneumonia is a later finding. Most of the studies, the patient mostly have 88% as a fever, and 38% as a fatigue, and 68% as dry cough, mucus production, and rest are, muscle pain are some patients now. Most of the patients are coming. These are the statistics taken from different hospitals, China, Singapore, and US in early stages. These are fever, cough, dyspnea remain the most common symptom. And this recent publication I have added it because now this fatigue is coming one of the common in most of the patients. This is upcoming, which was not reported earlier. So let us see pathogenesis risk factor, because COVID is present like influenza, like influenza. So there is overlapping disease like influenza, rhinoviruses, other respiratory infection, particularly atypical pneumonia. Why it is atypical pneumonia? The typical classical lobar pneumonia features are not there. So it presents like a viral pneumonia, bilateral patchy opacity, and not much of symptoms of typical pneumonia. So that is mostly you should rule out all these diseases before thinking of COVID. And one important question being asked, does flu shot means influenza vaccination can protect COVID? The answer is no. But according to CDC, in the context of COVID pandemic, even if more important to do everything possible to reduce your illness and preserve your scar. That means if you're going to heal, you have to be in hospital. Hospital load is to be increased in coming season. So better to be protected, and you should not be victim of a suspected COVID. But actual truth is that you might have been influenza. That is very common. Based on coming to the diagnosis, this is already discussed. The RT-PCR remained the standard, and it's even if RT-PCR is negative, if nasopharyngeal swab, if clinically you are suspecting, radiological suspecting, repeat testing is essential till you are clinically ruling out or patient is coming to radiology. It is a very, this is a CT scan of very mild patient, mild may or may not get any shadows on chest X-ray, and both seeing the bilateral patchy opacity, faint opacity, maybe it's close to ground glass opacity, patchy ground glass opacity. So otherwise preserving the long parenchyma. This is again, it's a slightly severe patient, admitted patient, definitely not critically ill. So this is patchy, bilateral patchy opacity. So maybe not segmental opacity. So this can be seen with increasing ground glass. It maybe looks like crazy paving appearance. So this again 1% admission, not much of change even after 4 days. And today's topic is mild and moderate pneumonia. What I'm going to discuss, mostly treated with the supplemental oxygen and conservative manner. So mostly why it is important, most of the patients who are getting more than 81%, more than 80% patients remain mild to moderate disease, and only few, maybe 15% to 15% patients remain required hospitalization, and very few 5% may be critical ill, but number seems to be lesser day by day, particularly in India as the disease advances. And according to severity, the recommendation-based treatment is and transmission scenario. Treatment is the mild patient. Although we are isolating in COVID hospital, this patient can be strictly isolated in home care facility, and slightly symptomatic, that must be observation in hospital. And if need oxygen, we can give it, and seriously patient to be treated with mechanical ventilator ICU care, which my colleague is going to discuss briefly tomorrow. And SARI cases coming under that, also severe respiratory infection, that coming fever, cough, will last more than 3 days. So that requiring hospitalization. That is the definition of severe acute respiratory infection, that otherwise known as SARI. So adult with pneumonia may not severe signs of severe pneumonia. That means the oxygen saturation at less than 93 and respiratory rate less than 30. And let us see how really the COVID infection course, what is the course of infection. Clinically, it can be stage 1, stage 2, stage 3. Stage 2 is non-severe but symptomatic that requires hospitalization. Stage 3 is severely, but it depends on the viral response. Some patient can be called, body immunity can somehow that can be stopped, may not be very severe. And there's some people, there is hyperinflammatory cytokine storm, we'll discuss later, and more we'll discuss tomorrow. So that is dependent patient. And why I'm discussing some mild symptoms, but after a few days may have a precipitous clinical deterioration, because it need to be a care, because it's a poor outcome, increasing WBC, suddenly lymphopenia, prolonged prothrombin time, elevated fever and liver enzymes, LDH, D-dimer, elevated interleukin 6, C-reactive protein, and procalcitonin. These are also markers that also say how patient is progressing. And case fatality is disproportionately higher. It is seen in all the studies as shown. Elderly have a more fatalities more, and conditions are higher hospitalized than non-hospitalized patient. So this studies of recent NEJM on 24th of April, they cleared that established the potential risk factor of severe COVID, elderly patient more than 65 years, and chronic lung disease, cardiovascular disease, patient having diabetes, particularly uncontrolled, obesity, particularly morbid obesity, immunocompromised, maybe any cause, maybe anti-cancer therapy, then immunocompromised any cause, or steroid, and end-stage renal disease and liver disease are this potential risk factor for COVID. And progression of complication, pneumonia, it can happen. Most of 90% patient has a pneumonia. Others has, some patient may go to ARDS, shock, septic shock, acute kidney injury, renal failure, acute hepatic injury, cardiac abnormality, acute cardiac injury, cardiomyopathy, arrhythmia, and most important is hospital-acquired infection. It depends on the prevailing infection of your hospital. And laboratory investigation will do complete blood count, CBC, that's liver LFT, liver function test, C-reactive protein, liver enzymes, and procalcitonin, ferritin, D-dimer test has to be done routinely. And lymphopenia is one of the very common finding, thrombocytopenia, leukopenia, but later on that increase. And procalcitonin, other has to be discussed tomorrow. That is marker of severe disease. And also this also discussed tomorrow. And particularly this increased D-dimer and lymphocytopenia is the predictor of the severity and disease outcome, mortality. Let us come the pathogenesis. How it's compared. This is linked because we need to know how we can use treatment on the basis treatment as planned according to the pathogenesis. Look at this is spike protein, envelope protein. This is RNA, red color, single-strand RNA. The membrane glycoprotein, nucleocapsid protein. Why it is important? The spike protein get attached to the AC receptor, and the AC receptor is that attachment is more important. Why is it this? One is AC receptor, one is transmembrane serine protease that cleaves and activate viral glycoprotein, which facilitate the virus cell for membrane fusion. So that helps in getting into the host cell. Again, AC receptor also serine protein along with serine protease priming to enter into the cell of the host cell, that means human cell. So that once it entered to the human cell, so that is this activity, his activity starts, virus activity starts. This are the drug that use against those inhibited serine protease in prevent viral entry. And this also, chloroquine also inhibit viral entry, endocytosis, in multiple mechanisms as well as host immunodeficiency effect. And also target the all ARB can help in restricting the entry. ARB angiotensin receptor blocker, those are on treatment. They are naturally they are protected, and these are the mechanism. Once it is gone inside, this spike proteases. That other mechanism is there. That means to stop again progress in getting inside. So it can be neutralized by SARS convalescent serum. So this is one of the treatment that is under trial that has looked to be successful. And the next mechanism is this go to proteolysis inside the host cell, and that is inhibited by Cametex, lopinavir or darunavir. This is actually anti-HIV drug. So this also used for treatment. It is again on trial, nothing clear. And this most promising drug that has come up, this remdesivir. So this has last 3-4 days. It has 5 days before. It has one result has come, and it looks to be very promising and successful. Phase 3 trial has come, and that inhibits viral RNA-dependent DNA polymerase. So this is, and the last one remain. This is something to discuss cytokine storm, because like H1N1, this or MERS, or this again T cell monocytes with high interleukin secretion, they all enter to the pulmonary circulation, causing an inflammatory storm that is known as hypercytokinemic inflammatory syndrome, particularly in severe COVID patients. All moved into the vessel, and particularly it caused edema, and which is hyperinflammation. That means inflammatory.
Hello, all are mute, please, microphone.
I request to mute the microphone, please. So this all the heavy inflammation that cause edema, exudate, and inflammatory influence so much that thick fluids get in the alveolar sac. It behaves like a solid, or which acute. That means presence of severe pulmonary edema, present as ARDS like symptoms. So that is a very sick one. The details has to be discussed tomorrow. And one drug is available, that interleukin 6 blocker that binds IL-6, prevent receptor activation, inhibits IL-6. This is tocilizumab, and details will be discussed tomorrow. And this is in nutshell the total process. And coming to the real treatment, already we discussed this. There's no proven approved by FDA or by standard agency that any drug. So these drugs looks to be remdesivir, hydrochloroquine, lopinavir, IL-6 blocker may be promising, but it's all can be on trial basis. And most important is take care of the patient. Most of the fluid management is important, because patients should not develop shock. And SARI cases has to be treated cautiously, IV fluid, and with resuscitation. Empiric antimicrobial should be given, because later on what has happened after 3-4 days, the superadded by bacterial infection. So that to prevent that, we need to give antimicrobial, particularly strain that is more common, according to strain, more common in your hospital. The empirical therapy should be de-escalated on the basis of microbiological result and clinical judgment of improvement or deterioration. Close monitoring patient is has to be there. This already I discussed that my patient may go from bad to worse condition. So timely, effective, safe, supportive therapy is remain the cornerstone of treatment. And community communicate with our patient, with patient family, and discuss with family regarding every step outcome, patient condition, because patient attendant may not able to go the patient because of restriction of getting infected, because patient is isolated in a very, very difficult condition. So that patient has to be, attendant has to be informed properly, family has to be assured, and understand the patient value and preference regarding the sustaining intervention, understand the patient comorbid condition also, and we must see which drug can be started, which drug may be stopped, which is not required to stop. Like patient on corticosteroid indicated for some other reason, and patient coming to steroid should not be stopped, because so there is some off-label drug, that means already DGISM direct already recommended. Hydrochloroquine initial dose is 400 milligram BD for day 1, and followed by 200 milligram BD for next 4 days. It can be, and this is for 5 days treatment. Azithromycin 500 milligram daily for 5 days. This has to be given empty stomach, and drugs should be administered. So that we should monitor close medical supervision, and particularly QT interval must be done. ECG daily ECG to be done. And other therapeutic measures like hypoxia, rapid worsening of the radiograph, that has to be patient clinically deteriorating. So we should suspect cytokine storm. Regarding if there is something that we may use anti-IL-6 inhibitor, or the patient is already on steroid, which has to be continued, or in some cases it 1 to 2 milligram kg per day given for 5 days. And patients often suffer anxiety, and fear. They should be supported by psychological counseling. It is very important because this patient is innocent. He doesn't know how he got infected. Looks like that, but he is in a difficult condition, and discharge once patient improved and clinically asymptomatic, negative PCR result at least 2 consecutive up to with more than 24 hours apart, with resolution of symptoms and improvement of signs and symptoms, that patient can be discharged, and decision to be taken according to the concerned clinician day-to-day, case-to-case basis. So coming to the take-home message, so COVID-19 present with cough, fever, malaise, myalgia, GI symptom, and anosmia. Diagnosis of RT-PCR of a nasopharyngeal swab or other specimen is most important. Management depends on the severity of disease. If a mild patient, it typically recover at home, but can be isolated in COVID-specific setup. Patients with moderate severe COVID-19 are usually hospitalized for observation and supportive care. There is no proven therapy of COVID-19. What we discussed, these are based on the mechanism of action, activity on virus, and we need to know evolving government guidelines, changing today, tomorrow it's changing, every day is changing. We need to follow the local government guideline, and this is all CDC guideline, WHO guideline, and most important, it infection control and prevention. It is the utmost care to be given on PPE for healthcare worker, social distancing, and testing test is most important, because many the asymptomatic carrier, they transmit others. So most, if you test at least asymptomatic carrier, asymptomatic person transmission can be stopped. And coming to the last one Lancet paper, this is COVID-19 is a human tragedy, but it's also an opportunity to ask what kind of society we is for a pandemic we received. It doesn't matter pandemic comes, but it matters how we respond to it. Our response is more important. So coming to the slogan of our Prime Minister, Do Gaj Ki Duri, that means 2-meter distance to save nation and save life, and do not do handshake, namaste, and we let us salute, and this is namaste. And this is end with my discussion, and any questions we'll happy to take. Dr. Manoj, please join with me.
Thank you, participants, for your patience hearing. Am I audible? Hello. Yeah. So here I just want to inform you all that our respected director, Madam Professor Gitanjali Padmanabhan, will be interacting with you for a few minutes. After that, we will take your questions. Okay.
Okay. Thank you.
Can you see me? Can you see me? Am I audible? Am I audible?
Hello. Good afternoon, ma'am.
Yeah. Good afternoon.
Good afternoon.
Yes. Good afternoon. Yes. And thank you all for joining this webinar. And yesterday and today, our faculty have put together something which we thought would be important for all of you. And I have been watching from my office. I have been watching the the donning doffing which our nursing faculty have put together a video, and I have listened to Professor P.R. Mahapatra's lecture also. So my question to you is, if you have any other particular topics you would like us to cover, we would be happy to put together a program for you. So you can list some topics which you feel would be interesting for you, which will be useful, and at what level. For example, we need to know whether it is meant for doctors, for nurses, or whether it is training for your other healthcare workers. So if you can clearly give us some topics which you want us to prepare, at what level you want it to be prepared, and we will be happy to put it together for you in about 2 weeks, and we'll be able to present it to you. Otherwise, I am very happy that you have all participated, interacted so well. And so if you have any questions, please feel free to ask. Our faculty will be there to talk to you and interact with you. Thank you.
Ma'am, very nice to hear you,
Yes.
please send these all PPT and videos in our email. We have our all participants so that we can this transmit to the other also.
Okay.
It will be,
So
it will be,
one thing that we can do, so you please,
it will be uploaded in our website.
we can do it two ways. One is we can send a link in YouTube, so we
Yeah.
can have that, we can make it a little easier. And the other thing is you can also give your emails, we can see, because it's not that many, we can send it to your email IDs too. That should not be a problem. But sometimes what happens is the PowerPoint might be very heavy for you to get it. So in that case, we will upload it into our website, or we will upload it into our server so that you can download it wherever you are. That also we can do.
Very
We'll
nice.
do
Thank you.
multiple options. We'll make sure that you get it. Yes, of course. Anything else? Okay, otherwise I am back to Manoj and Professor P.R. Mahapatra. They will take questions from you. Thank you.
Hello.
Hello.
Yeah, now you are free to ask your questions.
One question was asked by whether hydroxychloroquine can be used in mild cases. The answer is no. But if you really want to treat the patient, look at any toxic features, monitor the toxicity, and can be given. But it is off-label. It is not clear. There is no clear recommendation of hydroxychloroquine, and recent trial has shown not much of benefit, but can be tried. Any further questions?
Is it audible?
Is it? Is it audible? Is it audible?
Yeah, any questions you can
Any
ask?
question, please?
The video is off. The video is off. Can you please switch on your video? Your video is off.
My video is off. Which video is? Video is on.
Sound mute chicken.
We can hear you. We can hear you clearly.
Sir, can you hear me, please, sir?
Yes, yes, please.
Yes, we can hear you.
Sir, I have a question regarding the preventive therapy for hydroxychloroquine for the healthcare worker who are working in COVID patient. Is there any recommendation for preventive therapy by hydroxychloroquine for the healthcare worker?
Definitely no clear answer is definitely the answer is no clear recommendation. The trial is still going on. The use of hydroxychloroquine to prevent COVID infection still going on. But in some cases, you are likely to get infect disease. You may take it for at least for 7 days.
So what are the doses for hydroxychloroquine?
Dose means first day 400 milligram BD.
Day on one day, and then every week.
Then every weekly you can take 400 milligram every weekly. That is the recommendation. And treatment is every day it's 400 milligram, and for day one is 400 milligram BD.
Thank you, sir.
Hello. Hello.
Yes, Vincent, please.
Yes. I'm looking at how long is it going to take us to discover the vaccine for this pandemic?
Regarding vaccine, it's $1 million question. Vaccine people, that means many, the news, many groups are trying their best to get vaccine. We do not know whether you can get things likely to be successful, but there is many diseases like HIV and dengue still do not have a vaccine. So we do not know. The time will be measured. Time will decide everything. What is really going to come.
Thank you.
No clear-cut answer for that.
But definitely not before 1 year.
Small query, sir.
Yes, please.
Which drug is contraindication, or which drug not to be used during this COVID treatment?
Which one?
Any special?
Which trial you asked?
Which drug? I mean, any drug is there in contraindication or not to use during COVID treatment?
There is not such drug, nothing like contraindicated, but definitely, if you feel that, somebody, it's, that there is a mechanism of thrombosis there, So you should not give any drug that causes prothrombotic drug. That I mean to say. So there is nothing like contraindicated, but it can be. You have to judiciously
during fever treatment.
Yes.
Hello.
Yes.
I am Dulal Kamtirala from Bangladesh.
Yeah, Dr. Dulal, please.
My question, now remdesivir is the right choice of medicine for the COVID-19 treatment? Is it?
Yes, looks to be promising. It is IL-6 inhibitor. It last 5 days you must have been used. That means its drug to be in phase 3 clinical trial is successful in multicentric RCTs. Randomized clinical trial is successful. Looks to be promising, but it is how soon it will be available. You do not know because only one manufacturer is involved. That we do not know, but looks to be promising. And the question asked by Dr. Kabir is, what is the price of remdesivir? I do not know, but I think time will say what's the price, your country will decide. But let it be available for the patient care, that is more important. And that should be available for allowed to be FDC and other, means your DCGI, government should allow to use it. That is more important. That's first to be done, the price is the latter thing. So next question, one question, is there any documentation indicating increased risk of exposure nurses and healthcare? The answer is if there is proper PPE, using proper PPE, proper precaution, there is no risk to healthcare worker. Whatever risk already been by having, either they have got infected from outside of the hospital by going the corridor, or they have some other in family or in market, some other. It's not, there's nothing proof that has got healthcare worker, but definitely they are prone, because I know the factors you can control inside the hospital, outside hospital you do not have the control. And third, so Dr. Ganesh has asked, can interferon gamma can be used in severe cases? I don't think interferon gamma has to be used, has been used. I do not have any recommendation for that. Anything, Dr. Dulal, please? No, it's not. Yes, please. Any question?
Yes, hello.
Yes.
Good afternoon, sir. I am Dr. Malik from Nepal.
Yeah, Dr. Malik, please
I'm
welcome.
Doctor of Surgery. We are attending the OPDs. Normally, is there any specific protocol to prevent ourselves when going to the OPD or going to the ward? Is there anything like that? Any guidelines?
So as per in our side, our country, what is being done, usually we are, except emergency care, emergency surgery or emergency patient who are handling, only routine patients are not handling. It is only because the patients are likely to get infected due to that, because of pandemic. That is the major reason. Otherwise, there is no contraindication. Even our patients are coming, some cancer patients, some other sick patients are coming. Our ward is almost full, but we do not have a route provision. And we have to take precaution of proper mask has to be used and spectacularly used to be, and have to be precaution, hand washing. All we discuss has to be precaution to be taken. Nothing contrary. Please follow your government guideline.
Okay, thank you. Thank you.
Yes, any question, please? Any questions? Happy to take. If there is no more question, I thanks on behalf of the institute, and we conclude this session. Thank you very much for your time. And tomorrow there is a big topic is there. Day after tomorrow. Day after tomorrow there is a holiday. Day after tomorrow at same time there is a topic on severe COVID-19 and severe ventilatory strategy to be discussed on Friday. Thank you very much.
So thank you, participants. And it's my duty to inform again that we will be having the last 2 sessions of this webinar on 8th of May. The time remains the same, that is 3 o'clock. So please do join us on 3 p.m. Indian time on 8th of May. We will be discussing the last 2 sessions on management of severely ill COVID-19 patients as well as the ventilatory management strategy. So thank you so much for your encouraging participations.
Thank you.